Are you struggling to keep up your consultation within 12 minutes? Maybe you find that you're spending so much time in data gathering, and when it comes to clinical management, you don't have enough time and you're rushing your clinical management. This is a common challenge that many registrars encounter. In this video, I'm going to share with you 3 practical tips you can use to take a focused history, compress your data gathering, so that you have enough time to finish your consultation up within 12 minutes. Tip number 1 is preparation. It's so important that you take the time to prep your case. When I'm saying preparation, it's really important that you understand it's not just about preparing vaguely. So many registrars, what they do, for example, if they're going to see the next patient presenting with headache, they study a bit about headache and read the guidance. But what you want to do is focus your preparation by looking at the patient's demographic. For example, a female patient who is pregnant presenting with headache, I would consider various differentials including preeclampsia and cavernous sinus thrombosis. Whereas if it's a 60-year-old gentleman presenting with headache, then my differential diagnosis will be different. For example, I'll be thinking about giant cell arteritis. So you need to focus your preparation based on the patient's demographic. Look at the patient's past medical history. Are there anything relevant in the history? Has there been any use of medication that could cause medication overuse headache? So you need to be very focused in your preparation. So use your time wisely and prepare your case. Make sure that you're looking not just at the guidance, but look at the guidance in context of the patient that you're about to see. Look at the clinic letters if there's anything relevant that you need to be aware of. By doing that prep work, when you're going to go in the consultation, you'll have a better idea how this consultation might go because you're going to have a game plan. It's so important that you plan your consultation beforehand. Then you're going to save yourself the time that you might use to be thinking through as you're going in the consultation. So make sure that you're preparing the case based on the next patient that you're going to see. Tip number 2 is to sharpen your questions. The quality of your history depends on the quality of your question. If you're going to ask questions that's not going to progress a consultation, then you're not going to get much out of the history. It's important that you balance the open-ended question in the beginning, then you might ask more closed questions during the middle of the consultation. So make sure that you know how to ask these questions. For example, if you've got a patient who is presenting with abdominal pain, what question would help you to progress the consultation? You might ask various questions, but a very important question to ask in the beginning is, where is the pain? The site of the pain is going to help you to think about what's the likely diagnosis based on the organ that might be affected. So make sure that you're asking sharp questions to progress the consultation. There are a bunch of questions you could ask. Many of these questions might not progress your consultation, but might be nice to know. So be selective in your questions and ask questions that's going to progress your consultation every time. That's really important so that you're taking a focused history. So often I see registrars asking questions that might be formulaic and don't progress the consultation. For example, asking questions such as, who's at home with you? Can you tell me more about yourself? These questions are good to ask, but they're not focusing on the matter that the patient presented, and it's not in context, so it's not good when you're forcing this question on the patient. Instead of asking formulaic question, it's better to ask the patient, how has this abdominal pain affected what you can do at home? By asking such question, then you will understand the severity of the pain on the patient's activities at home. It's different to just asking who's at home with you. So when the patient answers your question, how does it stop them from doing something? Then you can ask the patient, have you had any help at home? Then you will know whether the patient has got support at home. That's more effective than just asking formulaic question. Tip number 3, consultation framework. It's important that you have a consultation framework that you can use during the consultation that will guide you with respect to time so that you understand exactly where you're at in the consultation. If you don't have a consultation framework, then you might not have a notion as in where you're at with respect to time. when you have a consultation framework, then you understand that in the first couple of minutes, I need to get the patient's story out. So I will ask some open-ended questions, then I will ask some more specific questions after the patient has told me what they thought about or what's the problem that they're coming in with. So then by 6 minutes, I know that I should have got enough information about the patient's idea, concern, expectation, about the psychosocial, and I can commit to working diagnosis. But if you don't have a framework that you've got in the back of your mind, then you might be lost in the consultation, you might be dwelling in data gathering, and you're not going to commit to working diagnosis. So that will mean that you're going to ask various questions and you might not be organized, so the consultation might be dysfunctional. That's why it's so important to have a consultation framework so you can structure the consultation. A common mistake that registrars make in data gathering is talking too much. When you're talking in the first half of the consultation, you're not really using that time to gather information. The more you talk, the less information you're going to get. What you need to do in data gathering is to actively listen to what the patient is telling you, what the patient is not telling you, such that you're getting that information that you can use in clinical management. So instead of summarizing excessively in data gathering or reflecting back excessively what the patient is telling you, what you need to do is to listen to what the patient is telling you. By actively listening, then you're going to ask follow-up questions that's more pointed, and you're going to move the consultation forward. Whereas if you're just asking various questions and going in circle, then you're not going to focus your history. So that's really important. Last but not least, make sure that you've got your stopwatch in front of you so that you can keep track of time. If you don't keep track of time, then you're likely going to spend too much time in data gathering, and when it comes to clinical management, you're going to rush. So make sure that you've got your stop clock with you and have got this consultation framework so you know exactly where you are in the consultation. Are you enjoying this video so far? If you want more insight every week, then you might be interested in Fulfill Friday. This is a weekly newsletter in which I share exclusive insights on things I'm thinking and what I'm working. This is what some subscribers of Fulfill Friday have said. Join over 700 subscribers so you don't miss out on exclusive insights every Friday. Click the link down in the description below, it's completely free. Let me give you a working example of a simulated consultation, and you will see the feedback that I gave this registrar to make the history more focused. Your pace, you could increase it slightly, because if you're actually talking slowly, then it's more difficult to get more into. There's multiple problems. So there is a problem related to COVID that the patient is worried about. There's a mood problem, and then there is the fact that he's a carer. So that's 3 different problems. Now, I don't expect somebody to complete and solve everything in 12 minutes. It's a very complex case. What you want to do is to address one that you think is going to help them. That's the priority. And then possibly arrange a follow-up appointment to address the others. Now, I think choosing the depression is a good one to start with, but you should have addressed the fact that he was worried about the long COVID symptom. If you found this video useful, you might want to watch the next video where I talk about shared management. Click the video to watch it. Take care everybody, bye bye.